I just want to say we're thrilled that all of you are here with us tonight to be joining us for this discussion, a very important one. I'd like to begin by thanking our care team for helping to organize this event. Our care team is composed of staff members at the high school who volunteer their time to really focus on these issues that we're going to be talking about tonight. So a big thank you to them. A major focus each and every year for our district is the health and wellness of our students and staff, and certainly events like this support that focus. I want to especially thank Dan Milgate, our new superintendent, who's in attendance tonight, for all of his support and assistance to make tonight's discussion possible. I'd also like to thank Michael Zale, one of our county legislators for the 20th District. Mike met with us this summer and offered the support and assistance of Monroe County to help plan for tonight's panel discussion. I had the pleasure of working with Mike when he served on the Spencerport School Board, and he is an incredibly strong supporter of our district and our students. I certainly would also like to thank Cheryl D'Onofrio, the Monroe County Executive, who will be with us later tonight, for all the support the county provides our schools. Just as a matter of coincidence, over 50 of our students today were working with Mike Berry, the Executive Director of the Monroe County Youth Bureau, with our Choices program, and that's been a partnership we've had with the county for the last 4 years, and that has been incredibly successful for our students in our high school. So again, we certainly appreciate the county's support with all of our efforts. Certainly would like to thank our panelists who are here with us tonight as well for bringing their expertise to this event. After we have the opportunity to hear from Michael, our interventionist specialist for the district, Kate Zobke, and one of our amazing 12th grade students, Lindsay Gallagher, will be taking over to facilitate the panel discussion, and they will be introducing our panelists for this evening. So again, thank you for being with us this evening. I hope each of you find tonight's discussion to be informative and useful as we work together to support our youth and our community. So I'll turn it over to Mike Zale now. Thank you.
Good evening, and thank you so much for being here tonight. I'm excited at the fact that we were able to partner with the Spencerport Central School District and just how welcoming they have been in this partnership to join forces and take a look at something as tragic as this crisis is. I know that I come here as a county legislator, but to be completely honest, I'm really here as someone who is a parent of 3 boys in this district, a spouse of the love of my life who is here, and as someone who's also a teacher and a soccer coach to high school students. This is my 12th year coaching high school sports. I remember about a year and a half ago when I first went to a panel discussion like this with Senator Robert Ort, and I remember coming in with preconceived notions about what it means to be addicted and what it means to have this type of struggle. And I'll be honest that my preconceived notion was of just a person who is an addict. And it wasn't until that panel discussion that I realized the depth at which people struggle with addiction. And it hit me, as someone who has been a coach for as long as I have, that many of my players who have sports-related injuries are very easily susceptible to falling into this type of trap through prescription overdosage, and then that turning into addictions to much stronger medications such as heroin. That's when my perspective changed. We've got great panelists here, and one of which I've seen his presentation, Dr. Mendoza. When you take a look at the statistics and you take a look at the age ranges at which this hits us, no one is immune. And that scares me as a father and as a husband and as a teacher and coach. I am just very thankful, especially for our principal, Sean McCabe, for allowing just this opportunity to be here in this gorgeous facility. Certainly, I'm very grateful to the drug and alcohol counselor that is here, Katie Zobke, so close. But Katie, just thank you so much for putting this together. It was a tremendous amount of work, and I really do think Katie deserves a round of applause for putting this together. Thank you, Katie. Certainly, our panelists, one of which that I already spoke of, Dr. Michael Mendoza of the Monroe County Commissioner of Public Health for being here, Robert Zerby, Chief Medical Examiner of the Monroe County Medical Examiner's Office, Deputy Joe Resch from the Monroe County Sheriff's Office Crime Prevention, Chris Mears, our Chief of Police, my good friend that is here as well, and Daniel DeSalvo, Assistant Chief of the Gates Ambulance, which, as you know, we've got a partnership with them here in Spencerport, and Lori Drescher, a parent of a recovering addict, that are all going to be part of our panel this evening. I'd like to leave you with something and hope that maybe you can take a bit of a lesson from me. I pray that you come at this with an open mind, that you look at this as something that needs to be combated. And I thank you so much for being here simply because either you are interested in finding a way to help solve this situation, or you're struggling with yourself, or you've got friends and family who are also struggling with this. But for those of you who are coming into this just wondering what this is and how can I be effective, I just ask that you have an open mind and that you take a look at these individuals as just that, individuals that struggle. I promise you it will change you, and I promise you that we will be able to find a way to combat this forever. People are hurting. People feel like they need to do and be a part of something like this. And the truth is they need help. That's the bottom line, and that's why we're here today. With that, I'm very grateful to introduce a good friend of mine who wanted to take the time to be here tonight, and that is our County Executive, Cheryl Dinolfo. Thank you, Cheryl.
Well, good evening, everyone. First of all, let me say thank you to Spencerport High School and the district for always being on the forefront of making sure that the students in this district have the best possible resources to succeed. I've got to tell you, we've had a long-standing partnership with the Spencerport School District, and for those parents in the audience, you've got something special happening here at your district, and you should be incredibly proud. I want to say thank you to Principal McCabe for opening up the auditorium this evening, and certainly for your superintendent as well, to have tonight's panel discussion here in Spencerport. As I've said, our best opportunities are in our young people and are the people in this community, and we want to make sure that every one of them, each one of us, has the opportunity to succeed right here in Monroe County. And the issue of the opioid crisis is one that, you know, when I look at it, not just as county executive and as Mike Zale mentioned, is certainly as a parent of 3 kids of my own and 3 grandchildren as well, I look at the opioid epidemic, the crisis, as really the health crisis that is not only here in the county of Monroe and the state of New York, but in the country as well. And it could be a member of your family, it could be one of your kids, it could be your sister, your brother, your husband, your wife, it could be somebody at work. And the best way to combat this type of crisis is to be educated about it. What are the signs? What can I do? How do I get help? Who do I turn to? And so when we have these types of panel discussions like we have here tonight in Spencerport, we learn about what is happening. We learn how to combat. We learn what are the best preventative measures that we can take for our family, for our friends, for our coworkers, for this community. And I can't be thankful enough for the partnership that we have with our county legislators who are here, with our sheriff's department, with our police department, and certainly with Dr. Mendoza leading our health department as well. I know you're going to hear from our panelists, but I have to tell you that when Dr. Mendoza stepped on board as the Commissioner of Public Health here in Monroe County, we sat down and we said, you know what? The health of our community is extremely important. We cannot be reactive. We have to be proactive in identifying the needs of this community and proactive in going out and helping our community remain healthy. And that's what we're doing here tonight. We're looking at a crisis. We're looking at something that has affected so many people in this community, in this country. But here in our community, we're doing something about it. And I know that's why you're here tonight. I want you to know that I congratulate you and I thank you for being here this evening. Spread the word to your family members and to those in this community that we are here to help and this is the part of the solution. So again, thank you for being here tonight. Thank you again to the Spencerport School District for having us.
Good evening. I'll be another person to say welcome. I'm so glad that everyone is here this evening. My name is Kate Zobku. I am the new intervention specialist for the Spencerport Central School District. I came on board this year as a brand new staff member in a brand new position here to support the district in any way that I can in terms of chemical abuse issues that might be going on in the family. I have an intervention background. I am a certified alcohol and substance abuse counselor, but my passion is working with families and looking at the entire family system that gets affected by addiction. The person who is using the drugs and alcohol, yes, is hurting, but the family members are hurting just as much. So any way that I can help the entire district to heal, whether it's kids who are actively using, kids that might be at risk for using, or people who have kids who have family members at home that are struggling with addiction, I am here to support the entire district. The goal of our entire care team tonight is for you as parents and community members to better be able to identify the signs and symptoms of drug abuse and to know what resources we have in our community if your family begins to struggle with addiction. We'll have a brief survey at the end of the conclusion of this evening if you can let us know if we've hopefully accomplished this goal. We'll have you take out your devices and fill it out right here at the end of the evening, so hopefully we've achieved our goals tonight. Before we begin to hear from our panelists this evening, I'd like to share with you what we are seeing in terms of substance abuse here at Spencerport. So unfortunately, we're going to throw a lot of data and statistics at you tonight, but I think it's a lot of important information to have so you guys can understand where we're coming from. The Youth Risk Behavior Survey is a survey that the school district participates in conjunction with the county every 2 years. We had roughly 800 of our students take this survey in March of last year, and this was the data that was recently compiled and distributed to us. So this is exactly what we are seeing in terms of substance abuse right here in Spencerport. So obviously tonight a lot of the focus is on the opiate epidemic and what's happening. We know that only around 3% of our students have said that they have tried heroin in their lifetimes. That number is not surprising to me. That number is what we're seeing roughly across the county and roughly across the country as well. The number that I really want everybody to pay attention to this evening, though, is that 11% of our students, so roughly 1 in 10 of our Spencerport students, said that they have taken a prescription narcotic that was not prescribed to them, meaning they are on that slippery slope to addiction. That's the number that I want us to pay attention to as family members, community members, teachers, educators, because this is 1 in 10 of our students are at risk of going down that slippery slope of addiction. This is where we start the conversation around prescription drug safety, education around addiction, and how, if you've ever said, "not my kid," be aware that it could be your kid. The best way for us as parents and community members to begin to combat this disease is through open communication and utilizing the resources that we have. So those resources are here on hand with us tonight. So I'd like to ask our panel members to come up on stage and grab a seat.
So first of all, I want to thank you all for being here. It's great to see so many people out in the crowd. I acknowledge that this can be a difficult topic for people to talk about, to hear about, to recognize that it is in our communities. But I want to commend all of you for your courage for being here. I come at you not as an expert, but as a fellow citizen of Monroe County, as a father, as a husband, as a concerned person for the future of the health of all of the residents who live in our county. And it goes without saying that this is a problem of epidemic proportions, and I think our way through this will be through forums like this, where we can get together, have an open conversation, acknowledge that this is difficult for a lot of us to talk about, because many of us have experienced addiction in one way or another. But I do think that to the extent that we can be open and talking about this and non-judgmental and talk about the facts and talk about our emotions and talk about what we're experiencing as a community, I think only through that openness will we find a way through this epidemic going forward. So again, I'm coming to you as both the Commissioner of Public Health, but more importantly as a fellow resident of our county. So I'm going to spend some time talking about addiction and recognizing that addiction is a part of the opioid overdose problem, but it's not the only part. Okay, so as was mentioned by legislator Zale earlier I couldn't have put it better myself, addiction is a disease. Addiction is not a choice. People don't wake up one day wanting to be addicted. These are people, these are our spouses, our kids, our parents, and they deserve every measure of compassion that we have to offer. It's not unlike having diabetes or heart failure or depression. These are chronic illnesses that people live through and survive through and struggle with. People will have good days and they'll have bad days, and our job as peers, as loved ones, is to be there and to support them. We consider it a disease because it impacts the way people live and the way they work and their emotions and all of the things that we need to pull together to be able to do all the things that we do in our day. And people who are addicted try their hardest to get through it, and they struggle because it is a very hard thing to control. So hopefully you can see at the bottom here, these are PET scans of the brain, just to show you that this is a real illness. These are PET scans that look at brain activity. On the far left, this is the scan of a person who does not have drug use. The middle scan is the scan of somebody who has cocaine addiction that has been without cocaine for 10 days. As you can see, there's still a measurable difference in that person's brain activity after 10 days. And then if you go even further out, 100 days from last use, there are still measurable differences in that person's anatomy. Okay, this is a real illness. This is not a choice that people wake up and say, I want to have an addiction problem. This is a disease that we need to work through. So people often wonder who's at risk for having an addiction problem. And the reality, frankly, is that any of us is at risk. About 50% of the risk factors that go into contributing to addiction are genetic, and about 50% of them are environmental. So who you live with, where you grow up, your economic situation, exposures, and early use, really important. If people use early, we know that that's a definite risk factor for having addiction down the road. And again, most of these things aren't choices. These are risk factors that we all have or may have, and we've got to be aware of them so that we can do what we can to prevent this for our loved ones. In terms of the impact, I think you hear a lot about the statistics and the dollar signs and all that is there, but I think what's really most important is to underscore the human impact of this problem. I've had the fortune, if you want to call it that, of hearing so many stories. And as a scientist, as a physician, I thrive on numbers and data and evidence. But quite frankly, what moves me is hearing about the stories. These are people that we know, these are our neighbors, these are our families, and to hear about how this problem impacts the life and the well-being and the productivity of our community is really what strikes a chord with me. And so, as you think about the statistics that it costs, drug abuse costs society is $120 billion a year. Prescription drug abuse alone costs society $55 billion a year. And getting at that human impact, 1 in 10 children in the United States lives with at least one adult who suffers from a substance use disorder. And so just by looking out at the crowd, it's pretty obvious that there's somebody in this room who's likely been exposed to this in a very real way. And the part that really gets to me as a parent is that the majority of the kids who live in a home where substance use is an issue, the majority of these kids are younger than 5. Okay, so this really strikes at the prime years of development for our future generations. So I've spoken a little bit about addiction, and I like to talk about addiction as separate but related to the opioid overdose epidemic, because there are a lot of people who suffer through addiction who don't overdose, thankfully. And there are a lot of people who have an overdose, either survive through an overdose or who don't, who didn't necessarily have an addiction problem in the first place. So I think it's important that we think about the overdose problem as a part of, but not entirely a result of, the addiction problem, okay? Because when we look at how do we turn the tide in our community, we need to keep working on addiction, but we've been working on addiction for a long time, and it is extremely hard. I think working on overdose is, to some degree, a little more accessible, as long as we can look at it and take some what I consider common sense measures to try to curb the overdose death problem as well. So let's talk about overdose, somewhat as separate from addiction. So people often wonder why. Why is this a problem now? We had a drug problem in the 80s, we've had a drug problem in the 90s. What makes it so difficult now? And it is a very complicated story. As a physician, I can tell you that when I was in training, one of the contributors was that the regulatory agencies said, we're going to make pain the fifth vital sign, okay? And it seemed accurate at the time. We want to identify anybody who's in pain, and we want to help them to not have pain. That seems very obvious. But unfortunately, what sort of happened in the coming decade is that we turned pain into the enemy. And the reality is that a lot of people live with pain. And for a lot of people, they can't avoid pain. And for a lot of people, you can't put a number on their pain. And so the medical community, I'll admit, owns a fair amount of this problem because we've turned pain into the enemy. And whenever you have an enemy, your job is to fight the enemy. And so what came from that is this huge preponderance of prescription opioids that we now know, looking back, we probably would have wanted to do differently as a community. To give you a sense of how prevalent the painkiller problem is, back in 2010, there were enough painkillers prescribed to medicate every US adult around the clock in the US for a month. Just think of that. I mean, you know, for those of you who use opioids for hopefully constructive reasons, think of that. Every adult in our country could have had enough painkillers to be treated around the clock for a month. I won't doubt the fact that the industry, the pharmaceutical industry, had a huge role in marketing to all of us about the pain issue and doing everything we could to fight pain. There really is no reason for Opana and some of these other drugs that are out there right now that are 50 times stronger than heroin was in the 60s. There's just no medical reason for those medications. And then more recently, you know, with efforts to try to curb the prescription opioid that are going into the market, we physicians have gotten a little bit better at that, but unfortunately, we didn't pay enough attention to the addiction problem. And so if you cut on the supply of opioids and you don't fix the addiction problem, people will go to the streets because we haven't fixed the root of the problem. And so again, this is just one of those confluence of complexities that we didn't totally anticipate as a community. And then unfortunately, most recently, probably the biggest reason why we're falling behind in some regards is that you know, people are mixing heroin with all sorts of stuff. You know, and this stuff is potent, and often they don't even know what's in it. And we're identifying compounds that we did not even know about 3 or 4 years ago. And our tox lab is really at the forefront of this, trying to figure out how to get through problems that we are frankly new to. And so when I talk about how do we prevent overdose, you know, the public health approach is, you know, what are the risk factors for a problem? And what can we do to attack those risk factors? And so, you know, this is separate from addiction. I want to talk about the risk factors for opioid overdose. So what are the things that make it likely for somebody who's using to have an overdose situation? Well, one is if you're mixing substances. You can't predict what's going to happen if you're mixing things. If you're using alone, okay, you know, we don't want anybody to use, but if you're going to use with other people, you're less likely, according to the science, to have an overdose or to die from an overdose, ideally because the other person is there to help you if something were to go wrong. But using alone is a definite risk factor for dying. People who are abstinent or not using for a little while who relapse are at greater risk for an overdose because they have had less of the substance in their system, their body is somewhat more naive to it. If they go back to using as much as they did before, they're again at higher risk for dying. And then again, when you're mixing or using opioids from different sources, again, you can't know what the potency is or the quality is, and that can put you at risk for death. And then obviously having other coexisting illnesses, especially mental illness like depression, that's a definite risk factor for dying from a heroin overdose or an opioid overdose. So as we think of ways as a community, we need to be thinking about the risk factors for opioid overdose because this is separate from the addiction problem, a problem that we need to also pay attention to. So I'm going to give you some of the statistics, and I want you to just absorb, because this tells a story that I think is one that none of us can be proud of. In 2015, the number of drug overdoses exceeded the number of deaths from HIV and AIDS in 1995. So for all the attention we paid to HIV and AIDS in the 80s and 90s, the drug overdose problem has far eclipsed that. Car accidents, gun deaths, gun homicides, these are all things that we want to avoid. and drug overdoses are far and away and probably going to continue to eclipse all of those other causes of death. To give you a sense of numbers over time, red is the red bars are the drug deaths, drug-induced deaths. The blue dotted line is motor vehicle accident deaths. That has declined over the years, as have deaths from firearms, for all the attention, rightfully so, to firearms. Deaths from that have not nearly been as much as the number of deaths due to drug-induced death. To give you a sense of what people are dying from, we were pretty stable here with regard to heroin until about 2010, which coincidentally is when the increase in prescription opioids started to level off. So this, we believe, is the reason why people are shifting from prescription to heroin. And it's around 2011, 2010, when a lot of the measures went into place, like iStop, that your physicians are using to see if people are doctor shopping for prescription opioids. And you can see only recently has the synthetic opioid curve really taken a sharp turn upwards. So these are your fentanyls, your carfentanyls, and all the newer compounds. So, but the bottom line here is that of any opioid, it's going up, okay? And this is something that we've got to take a closer look at. As a physician, as a public health professional, this is sobering because our goal as public health people is to see life expectancy only go up. In a country like ours, there's really no reason why life expectancy should go down, and unfortunately, we saw just that in 2015. The only other time in recent history when life expectancy went down was in the 90s, and we think that was due to HIV and AIDS. So we've got to pay some attention to this. We've been making good progress for the 20 years since then, but this is a trend that we've got to pay attention to because we cannot allow it to continue. To dispel any myths about this being a problem that obeys demographic boundaries, it does not. Rich or poor, Hispanic, black, or white, as you can see here, the majority of those who have died from opioid overdose are white. Okay, so this is not an urban-only problem. It is an urban problem, but it's also a rural and a suburban and a rich and a poor problem. And so we can't ignore that reality. And so as you think through who in your family and who in your community might be affected, the reality is that truly anybody could. When you look at how we're doing across the globe, I'll spare you the math here, but basically what this statistic shows is it takes all the opioids that are prescribed, and it sort of makes them sort of that they're apples and apples, so you're not comparing Oxycontin to Percocet to Vicodin, and they just make it all on the same scale. And as you can see, in the United States, we prescribe far more opioids than any other country in the world. And unfortunately, for all of the prescriptions that we have, people in the United States don't report that they're in less pain than the next country, okay? So if you look at how we're doing over the years, the percent of people that report lower pain is not there. I mean, if anything, people are reporting more pain over the years. And so for all of the prescription opioids that we're putting out into the community, we're really not getting any improvement in pain. And so that really underscores the reality that we need to pay more attention to prescription opioids. So this is the number that many of you have heard and seen. This is the reality. We had 169 deaths from residents of Monroe County in 2016. The number speaks for itself. This is a 2.5-fold increase over the prior year, and there's no sign that this is going to be letting up. And we're doing everything we can. We've known about these numbers. We've been trying everything we can to get out into the community and do what we can. But the reality is that, like other communities and like other states, this is a problem that we need to work even harder to keep up with. And we're seeing this across the region, and this is not just Monroe County. So what you're seeing here is the heroin overdose ER visits across Monroe County, Finger Lakes region, and all of upstate New York, and we're not alone. Okay, these are numbers that we're seeing across our region. And as much as we can try to point the fingers at this or that, we should be pointing the fingers directly at ourselves. So what are we doing about this epidemic? And so what I'm highlighting here are some of the efforts that we've done within the health department. And so for my staff at the department, what I've tried to instill upon them is, we can't be everyone to everybody. We can't do everything for everybody, but when it comes to the opioid crisis, there's a lot that we can do. So, we want to focus the message in our community. The mantra that we want you all to come away with is that addiction is a chronic illness and overdose is preventable. Okay, if there's one thing that I can impart upon you tonight, it's that message. We want to take a leadership role in certain areas, and where we want to take a leadership role is in educating people about overdose, talking to people about the importance of naloxone, which I'll get into next, and through Cheryl Denolfo's help, we have developed a plan to establish a medical examiner fellowship, which is first of its kind, certainly in New York and potentially across the country, where we're going to be training in our medical examiner's office future pathologists to help to curb some of the demand that we have in doing all the autopsies, unfortunately, for our loved ones. We want to sustain the Office of the Medical Examiner. We want to sustain and grow the toxicology lab. We want to sustain and grow the data that we provide to all of you. And we know that the data isn't just going to come from the medical examiner. We've got data all across the community, and one of my jobs is to try to figure out where do we get all this data, how do we put it together so that people in the, on the streets, in the community, on the ground, can use those data to make an impact. One of the areas that I feel fortunate that I can help to influence is, as a physician, I have some sway within the physician and prescriber community. And so I'm working with my colleagues in medicine to talk about, trying to be more appropriate about how we prescribe opioid pain medications. Partnering with the Medical Society in Monroe County to educate people about appropriate pain management, looking at non-pharmacologic ways to manage pain. These are all things that we've got to keep working on. There are areas that the health department really doesn't have a direct role in, but we do play a huge role in trying to support all the great efforts in our community, especially in the treatment realm. We've got an outstanding quilt of behavioral health, recovery support, even in primary care, access to acute services and rehabilitation. I mean, that's not to say that we don't need more, but we have a great group of organizations in this community. I think we're very fortunate. And whenever I hear, so-and-so is not doing enough, it strikes a chord, because it doesn't speak to the dedication of the people that I know in the community that are doing all this great work. And then I want to send a shout out to all the other sectors within our community that we collaborate so closely with. Law enforcement, public safety, first responders, the business community, 911. There are a whole host of people that we're fortunate to partner with in this community, and I think we're very lucky to have the degree of collaboration that we experience here in Monroe County. The last slide, what can you do? First of all, being here is one of the first steps. Your being here, your willingness to confront your own uncertainties, your own gaps in knowledge, to address some of the stigma that might be involved, that you might feel about addiction. Confronting that so that you feel comfortable talking to your peers, to all the other parents and students who are not able to be here tonight, that's the first step. We need to have a conversation openly across the community about this problem, because if we just bury our head in the sand, it's not going to go away. I want you all to go home and look in your medicine cabinet. Look to see if there are opioids in there, and whether they're expired or not. If you don't need them, get rid of them. Okay? Don't hang on to Vicodin for that one day when you might need Vicodin, because unless you can be sure that Vicodin won't get into the wrong hands, it's a time bomb. It's an overdose waiting to happen. And I want you to look at those medications especially as a risk factor for overdose. I want you to talk to one another, especially our kids, our younger members of our community. Encourage them to be open about this. They see it. My kids see more than I know that they want to tell me about. To the extent that I can invite that conversation with them, I think that's the first step that we can take as a family. Another step that we won't go into today, but getting naloxone. Naloxone is perfectly safe. It's the antidote to reversing an overdose. It is completely harmless. Okay, if I were to give Mr. Zerby over there a dose of Narcan right now, he would not feel a thing, assuming he didn't use heroin recently. He would be just fine. It's perfectly safe. You ought to have it. It's safer than the EpiPen. So for all of you who know kids or adults who have an allergy, you may be familiar with using an EpiPen. An EpiPen is more dangerous than Narcan. And I want Narcan to be in every AED, every public place, every restaurant, every business, every school, every pool. in this county. And then again, I want to reiterate, that addiction is a disease, that the people who struggle through addiction are our friends, our loved ones, they deserve our compassion. And then I also want you to look at overdose as a separate, related, and preventable problem. And with that, I will turn it over to the next panelist.
So I'd like to introduce our second panel member, who is Mr. Robert Zerby, the Chief Medical Investigator from the Monroe County Office of the Medical Examiner.
Thank you for inviting me to this event. I think it's important. It's awesome seeing so many people here for whatever the reason. Hopefully it's more of a curiosity and not some sad thing that you're dealing with quietly at home, which, by the way, is one of the big problems. So if you're dealing with it quietly at home, get out and tell someone. Anecdotally, I'm going to speak about what goes on with the medical examiner's office and somewhat briefly. First off, clearly, if it's gotten to our point, it's too late, and we need to stop this. I can tell you, as Dr. Mendoza mentioned, this isn't like it used to be in the 70s when you had a junkie. And if I say junkie and you're from the era and you remember the 70s, you had a picture in your head and that's what a junkie looked like. There's no such thing as a junkie now. It's everybody. It's every race, all genders, too many ages, up into the 70s and some down into the teens. It's profound. And people know that it's an issue, and people are afraid to talk about it being an issue. You've heard in the media recently, if you looked, our turnaround time at our office is abysmal, and we understand that, but the load is outrageously huge. And one of the things, while it would be nice for us to have just immense resources and more staff and more facilities and more this and more that, every dollar you give us is a dollar you take away from someone that's still alive, and that's not a wise investment in money. The money has to be there. It's a finite amount of money, and we got to get that to the people who can use the help. Again, addiction versus overdose. A person who's addicted potentially can overdose, and we don't want that. You yourself, control you. In the old days, the old model, if you're older like me, you went to see the doctor told you what to do when you did it. The new medical model is your doctor tells you what to do and you ask why. You ask for alternatives. You have a voice, and you're supposed to be more of a dialogue, not a monologue. When the doctor says you're going to need this medicine, ask them why. Do I really need this medicine? Can I do something else? You have the ability to control it. What makes addiction kind of a weird disease, and the genetic part of this and the personality part of this is why it's kind of odd, is you could be an addict right now if you've never touched anything in your life, because you're set up for it. Your body, your chemistry, the whatever inside of you, if you take that and have that wonderful feeling, and make no mistakes, drugs make you feel good, and you're wired that way, almost automatically you're an addict. And you start down that path, and you can't just not be an addict one day. It doesn't work. So think about what you're doing. Remember, it covers everybody. And the big part for me will be later on if you have any questions relative to the medical examiner's office. But that's pretty much what I got to offer anecdotally. Thank you.
And next, I'd like to introduce our third panel member, Chief Christopher Mears from the Ogden Police Department.
I'd just like to echo a few things that some of my colleagues have said. When you look at numbers, it's very easy to just absorb them as statistics and not really put a face on it. But I can tell you, as going to the overdose calls that have occurred here in the town of Ogden and the village of Spencerport over the last couple of years, answering the calls when I was a sergeant, being the first one there on scene and seeing the death and just the despair in the family. It's easy to just look at it as a number, and when I tell you that we're on track for responding to 4 times the overdose calls this year as we did last year, and last year was double the year before that, that's pretty typical of the statistics you've seen. If you don't know somebody in the Ogden area, the Spencerport area that's been affected by this, you either have your head in the sand or you're not looking, or maybe they've covered it up, but I can guarantee you that everybody in this room knows somebody who's been affected. Dr. Mendoza talked about getting rid of those medications that are in your house, those opiates. We have a drop box, just for your information, we have a drop box at the Ogden Police Department. I know C-Zone has one as well, just up the road from us. If you can get in there during business hours, bring those drugs in and we will dispose of them for you. We take them to a medical incinerator and destroy them. If you can't get to us during business hours, call 911 and we will send an officer to your home and take them from you and dispose of them. saying they're a ticking time bomb is exactly what you have there. And it could be just that one painkiller that some kid takes sometime, innocently or not, that could be putting them on the road to addiction. So if you have them, get them out of your house. We're more than happy to take them for you. And it's an easy solution, it's an easy prevention. Narcan's been mentioned as well. Our officers all carry Narcan in our police cars here in the town of Ogden. We have used it more times than I would like to admit to, but in the last year, and just in 2017 alone, we're on track for 18 overdose calls. Either my agency or Gates EMS has administered Narcan at least 10 times to save a life. So if you can get it at your place of work, if you can get it at your home, if you know that you have a person struggling with addiction in your home, Strong is really good about getting that out to folks. So please take advantage of Narcan. It does save lives, and it gives that person struggling with this disease another shot. What are we doing in the Ogden Police Department to combat this? We're doing everything we can. But it does show signs that it's going to get worse before it gets better. You can't point to any person up here on this panel, I don't think, and say you're not doing your job, you got to work harder, because we're all there in the trenches every day doing what we can do. When we see an overdose now, we've partnered up with the Monroe County District Attorney's Office. We're going to thoroughly investigate every overdose case that we come across, and we're going to follow up on who the drug dealer is, the supplier. We're going to prosecute those people when and where we can. Other agencies, other police departments, and the Sheriff's Office and the State Police in Monroe County are all on board with this, and I think you're going to see a more aggressive attack on these dealers, but that's not the answer to the problem. I'll be quite frank with you, that's not going to solve the problem. The only thing that's going to solve the problem is dealing with the addiction in the first place, getting that person some help, and following through with that. We're going to take some questions and answers here, but for some reason, you've made a very big step in caring for your loved ones by being here. This is a big step. The bigger step is taking it home and having that talk. If you don't have that talk, it could be too late. It just could be too late. Today could be the day, tomorrow could be the day, but it could be too late. So have the talk, please. That's all I've got for now. Thanks.
Our fourth panel member is Mr. Daniel DeSalvo, the Assistant Chief of Gates Volunteer Ambulance.
Good evening. Just to kind of reiterate what Dr. Mendoza said and the Chief said, you see the numbers up there, but we're seeing it in the houses and the streets. The numbers are real. You just look up and you just see some stats, but we're seeing it on a daily basis. On my way here this evening, there was a call we responded to on 490 for a person overdosing in a vehicle on the expressway. And that's just bizarre. We've had it on 531. People come in from other parts of the region, surrounding counties. They come into the area to obtain their drugs, and they can't even wait to get home somewhere safe to use them. That's how big of a problem it is. I was talking with the medical examiner beforehand, and he says, sometimes, their person are brought in because it was a car accident. Well, the car accident may have been because they overdosed. We're seeing these people driving down the road, people crash and pulled over with needles in their arms, with children in the back seat of the car, and it's not getting any better. So by you being here tonight, that's awesome. The amount of publicity that went out for this tonight, the amount of social media attention, between first response agencies, the county. I know Dr. Mendoza is working on a lot of stuff where any way can reach people to let them know that there's help and there's avenues and resources out there. And the questions later on, I can throw some stats that I pulled up just specific to Ogden and Spencerport, but we're seeing the same people multiple times. And clearly they need help. They're either not getting the help or it's just not working. And it's a big problem, but every time we're called, we go out there, we do our best to take care of the patient, their families, be compassionate, give them the best care possible, and hope that that's the last time that we see them, and they'll turn around. But if not, we're prepared to be there again for the next time as well. So, thank you.
I'd like to introduce our fifth panel member, Ms. Lori Drescher, parent of a person in recovery and a certified addiction recovery coach.
My name is Lori Drescher, and I'm a mom in the long-term recovery from the effects of my son's 10-year struggle with opiate addiction, primarily with heroin. My son graduated from high school in 2008, Penfield High School, and in 2012, when most of his friends were graduating from college, he was graduating from his first rehab center. And that wasn't the last. In 2014, when most of his friends were starting their careers, my son was in the hospital after an attempted overdose. And that's when my life truly changed. As a person who has been deeply affected by this in my family, I made the choice at that time to get involved in our community efforts to try to combat addiction and to try to find recovery supports for those who are struggling to get treatment and to integrate back into their communities. We are extremely fortunate to be in a county and in a state that has devoted so many resources to this problem. I'm part of the Monroe County Opioid Task Force, and many of my colleagues up here are also members. We meet on a bi-monthly basis and address the issues, some very, very difficult issues, as you're seeing from some of the statistics that have been shared here. But I also wanted to share with you that in many ways my life has gotten so much better since becoming aware and since involving myself in some of the community efforts. I started advocating about a week after my son went into rehab after his attempted suicide. I spoke at the first State Senate Task Force on the opiate epidemic, and it was hard for me to get out of bed to do that. But I haven't shut up since. And I encourage any of you who have been affected by this to please get involved. There is so much work that needs to be done. And until family members begin getting involved in a large way, we're not going to be able to get the resources that we really need to combat this opiate epidemic in our communities effectively. Just a couple of tips. I've now also become a certified addiction recovery coach. I have a private practice working with family members who have been affected. I also work with individuals in their recovery, and I am a certified trainer with OASIS and ASAP, and I train people to become recovery coaches and peer advocates in our community. And we know that is an evidence-based practice that is helping many people sustain their recovery and even get into recovery supports. And sometimes I run support groups for parents using a coaching model. And I know many of you are parents, and you may be wondering if this is happening in your family, or maybe you know all too well that it is. And I know that there are some of you in the audience who have lost a child to this epidemic. So some of the things that I share with the folks that I work with, number one, and Dr. Mendoza said it first, is get educated. There are a lot of folks that have a lot of information out there and well-intended advice. Get educated, go to the proper sources and resources for your information, and get it as early on as you possibly can. Find support for you. There is evidence that shows that family members who are affected by this epidemic use a disproportionate amount of healthcare services. That's because we become just as sick as our loved ones do. We follow a very similar path. Their obsession becomes their drugs, our obsession becomes them. Get some help. You will not see when that invisible line to addiction is crossed. Why they start and why they can't stop are two different issues. Substance use is a choice. Addiction is a disease, and you will not see, nor will they, when they cross that line. Always be on their side. Even in your angriest moments, they need for you to be on their side, and they need for you to show love and compassion. That doesn't mean that you need to take abuse. It doesn't mean that you need to give in to their requests. You must set healthy boundaries. There have to be consequences. But love them unconditionally, because oftentimes that is the lifeline that helps them to find their way back. Thank you for letting me share my story.
And I'd like to introduce our sixth panel member, Deputy Joseph Resch, the Crime Prevention Officer for Zone C from the Monroe County Sheriff's Office.
Thank you. I'm going to offer some countywide stats to you. In Monroe County, we're fortunate to have a crime analysis center, and it takes all of the police reporting from all across Monroe County, from all agencies, and it puts it into a database where we can not only track crime trends, but we can also track the overdoses of heroin. And so for Monroe County, from October 1st, 2016 to October 1st, 2017, with regard to drug arrests, we had 739 total drug arrests, 500 felony arrests, and 239 misdemeanor arrests. For overdoses of heroin, in 2015, we had 71, 27 fatal. Narcan was used 21 times. In 2016, we had 317 total, 81 fatals. Narcan was used 181 times. And in 2017, so far, 474 overdoses, 89 fatals, and Narcan was used 294 times. Now keep in mind, with regard to these stats, these are only those that are reported to the police. So it's probably likely that the incidence of overdoses are higher, because not everything is reported to the police. With regard to overdose of heroin and age, in 2015, we didn't have any overdoses of those people under the age of 19. In 2016, we had 7 overdoses under the age of 19 with 2 fatalities. And in 2017, so far, 5 reported overdoses under the age of 19, and so far, 0 fatalities for this year so far, for that age group. Also, of course, the Sheriff's Office, along with the other agencies, are part of the opioid task force in Monroe County. And it's comprised of a police treatment providers, education, public health officials, and drug experts. And initiatives are enforcement, prevention, education, and treatment. And also within the jail system, we offer Vivitrol, which offers to those inmates who are being released who are addicts. And it's a voluntary program. Of course, all the cars in Monroe County Sheriffs, with all the various bureaus that we have, we also, along with all the other police agencies, carry Narcan in all the police vehicles. And lastly, I just wanted to remind everybody of the Good Samaritan law. For those people who are maybe a little bit anxious or nervous about calling the police for an overdose, if it's a medical emergency of an overdose, when the police are called, along with the ambulance, of course, you will not be charged, or the people in that particular instance will not be charged with a crime for possession of those drugs. What we want to do first off and foremost is not charge people, but first save that life. And so that's the Good Samaritan law. Oh, thank you.
Thank you so much. Now we'd like to open our discussion up to questions from the audience. Lindsay's going to ask our first couple of questions of our panel members.
So this question is for Mr. Drescher. What are the warning signs to look for if I think my child might be struggling with an addiction?
Thanks, that's a good question. Struggling with an addiction. I mean, first you have to know what the warning signs are of use. And many of our young people are starting with marijuana use, and it's getting trickier and trickier because of vaping and things like that. You don't necessarily smell it the way, you know, you did when we were kids. And, you know, there are just lots of ways to cover it up. I think behaviorally is the thing that we really need to keep an eye out for. Things like isolating, spending more time in their rooms, spending time with different sets of friends, new friends, different activities, dropping out of sports, grades starting to slip, making excuses just not to show up at things that they would normally show up at. Am I missing anything? When it becomes full-fledged addiction, honestly, I look back at pictures now, and it's so obvious to me, but sometimes it's a slow, slippery slope, and you don't always see those changes right away, especially if your kids are older and they don't live with you and you don't see them every day. But the clients that I work with, oftentimes, they describe some of the things that I just mentioned to you when their kids are still in high school and still living at home.
Thank you. What I'll also say in this district too, if you even have a gut feeling that there may be something going on with your student, feel free to call me. My contact information is listed on our website, which can be found right at spencerportschools.org. And my contact information is there. Feel free to call my office at any time. Our conversations can be completely confidential as well, and I can give you, some feedback on how to start that conversation with your students. Second question is for Dr. Mendoza. Following a sports injury, what questions should parents be asking their child's doctors regarding non-narcotic pain management?
So that's a good question. That's a really common question. As Bob Zerby mentioned, I think, as a physician, I want my patients to question me. I want them to understand that if they have an uncertainty, I want them to clarify that with me. When I see kids who have sports injuries, the temptation before was do everything you can to stomp out that pain and do everything, at all costs. And the reality now is that, we want to provide pain management. We want to do so in a reasonable way, but with my patients, my goal is get them up on their feet as fast as possible, and you can't really do that if you're taking a high dose of Vicodin. And so, what I encourage my patients to ask me is, is this absolutely necessary? Do I need 2 weeks worth of Vicodin, or can I get away with 3 or 4 days? So if any of your physicians or if any of your children's physicians prescribe an opioid to you, ask that person, is it absolutely necessary that they take this much? And when is it safe to stop? And as soon as possible is the answer. As soon as you possibly can, stop taking that opioid is the right time to stop.
Chief Mears, what should community members do with prescription drugs that they are no longer using?
That's a great question. Again, we have the drop box at the Ogden Police Department that's available to anybody. You can just walk in, drop it in. It looks like a mailbox. It's secured in our office. Get it out of your house as soon as you can. If you can't make it during business hours to our office, if you call 911, I'll send an officer to your house. We'll pick it up and we'll dispose of it. I know the Sheriff's Office at their Zone C substation offers a very similar service. If you live out of the town, I know Gates Police Department will do exactly the same thing for you. So there are opportunities to get rid of that, and I recommend you do it just as soon as you possibly can.
And I also encourage you to go to the monroecounty.gov website, and with a little bit of Googling, you'll find that we have drop-off stations at the Eco Park. And there's a schedule for it, so I don't know the schedule off the top of my head, but we'll do everything we can. If you ever just want to drop it off at the health department, stop by my office. We will take care of it and get it out of your hands.
The other part too that I like that everyone had spoken about, looking in your own medicine cupboards and getting rid of the extra pharmaceuticals that you may have laying around. Also, don't forget about elderly family members that you may be caretaking for, or other family members that may have it around as well. Feel free to have conversations with those family members and make sure that their medications are kept safe as well. Hearing from students, a lot of them are saying that the first time that they tried pills was a family member's medicine cabinet. That's where they found it. Whether it was given to them or not, that's where they are starting to obtain a lot of their stuff. We got one question twice, so I will ask that one first. This one I will pose this to Dr. Mendoza, but anybody else on the panel feel free to answer. What are the concerns for people who are vaping? We have a community member that said that their child is blind to the threats of vaping. How can I convince her that it is dangerous?
I think the temptation is that if you're not smoking cigarettes, then vaping must be safe, and there is absolutely no scientific evidence to support that claim. Yes, if somebody's not using cigarettes, that's a good thing, but if they're going to vaping, we just don't know what the risks are. And everything I've read suggests to me that they're as bad, if not worse, than cigarette smoke. So, my advice to my patients, to anybody here in this audience, is that, vaping is not the silver bullet. It's not, if it was that easy, if it was truly that effective, then we wouldn't be talking about this problem. The reality is that it's not helpful, and it's a temporizing measure at best, but vaping is dangerous. We just don't know how dangerous it is, and I shudder to think in 5-10 years when the science comes out, we'll be looking back on these days and saying, I wish we had taken a stronger stance against vaping.
Chief Mears, how are our kids gaining access to drugs? Is it easily available in our community, or do they need to travel to obtain it?
It's a little bit of everything, but I think I would support that notion that the first use is probably coming from the unused prescription pills that are in either your own medicine cabinet or in a neighbor or a friend's medicine cabinet. The availability in the area here, we don't have our head in the sand. We know that heroin and opiates are here in Spencerport, they're here in Ogden. We do have a fair number of people. Chief DeSalvo mentioned people overdosing in their cars. We've had at least 3 people overdose in Ogden that were traveling from the city to points west. So people are bringing it into the area from the city as well. It's a mixture, and I guess it depends on the specific substance, but I would say if you're looking at pills, it's probably coming from everybody else's medicine cabinet. So get that stuff out of your house as fast as you can. We pursue the dealers when we get information, when we get tips and leads and whatnot. We're really quick to write a search warrant and get on it as quick as we can. So if we have good information about opiates or heroin here locally, we act as fast as we can. But I'd say the short answer is probably the pills are coming from your next door neighbor, your own medicine cabinet.
Thank you. For Mr. DeSalvo, in regards to the individuals that your department sees for multiple overdoses, what, if any, services are being offered to them for further treatment? Second person asked a very similar question, asking who's following up on the individuals that your department is seeing multiple times?
Excellent question. When we take care of these people, we transport them to the hospital. We relay that to the hospital. We ask them for social work help. A lot of times the police department's obviously there as well, anytime there's a drug overdose or any kind of drug interaction. So the police departments that we deal with follow up as well. There's many different avenues. A lot of it stems from us. We refer at the hospital. If there's something where there's children involved, we also have to do a reporting to child protectives and give them all the information as well. So there's a lot of different avenues. We, particularly from the ambulance, we start with law enforcement and also at the hospitals.
This question's for Dr. Mendoza. The focus has been on the opioid crisis, but is there a higher risk for opiate use and addiction from marijuana users?
Marijuana is a problem. I think, there is this temptation that legalizing marijuana is going to make this problem go away. Again, there is no scientific evidence to support that claim. We've done studies. I just looked up yesterday because I knew somebody was going to ask. The entire meta-analyses of studies that look at legalization of marijuana say that the evidence is mixed. It is true that if somebody uses marijuana, they're less likely to use opioids, but they're more likely to have an addiction problem. So you're robbing Peter to pay Paul. And the reality is that marijuana is not safe. There are health problems associated with marijuana. I don't think it's certainly not a policy approach that I think we want to encourage. You know, addiction's addiction, and I think we need to focus on addiction in all of its forms, be it from marijuana, from opioids, from cocaine, from gambling. You know, addictive behavior is addictive behavior. And I like vaping. I don't think you know, we're going to find a silver bullet in marijuana, certainly, and marijuana is dangerous. So I just don't think the answer is going to be in marijuana.
Following up with what you said, and this I think will open to all the panelists, particularly the criminal side of things. I apologize. The care team this morning, we all met as a group, and we were talking about the added ingredients that we're seeing in marijuana. And we're hearing from students that additional things are being added that may not be desirable. And we were wondering if in Spencerport we're seeing what else, or what you guys are seeing in terms of what's being added to marijuana, in terms of making it denser, so it's heavier, so it's, you know, more costly, or anything else. What are you guys seeing that's being put into the marijuana as well?
We have heard, although not in Monroe County, but we have heard that fentanyl laced marijuana has been being seen in other parts of the country. But with this regard to marijuana alone, marijuana hash oil can be vaped. We see a lot of that. And the tetrahydrocannabinol in the vape, the oils of marijuana, has a percentage of about 90% THC, compared to just the weed itself. And just the weed marijuana itself right now is around 20 to 25% THC. And just to give you a comparison, back in the 70s and 80s, the THC in marijuana was less than 2%. So you could say, in a sense, it's kind of a different drug today than it was back then. And right now we're seeing a lot of kids aged 16 to 21 crashing vehicles under the influence of marijuana, in some cases more so than with alcohol.
The next question is Narcan only for heroin, or can it be used for cocaine or any other drugs?
Your Narcan will block the effects of only your opiates. And Dr. Mendoza, jump in here if I misspeak at all, but that's the only thing that it's used for. If you're using cocaine and you receive a dose of Narcan, it won't have any effect. If you're smoking marijuana and you receive Narcan, it won't have any effect. If you are overdosing on an opiate and you receive Narcan, that should negate the effects of the opiate. With some of the more strong fentanyl mixtures that are out there, we're finding that we're having to actually administer 3 and 4 times, and Chief can probably elaborate on that, but we had one case this year where we think fentanyl, it was almost pure fentanyl, and Gates EMS had to give, I think, 4 doses of Narcan before there was any response from the patient. So the short answer is it only works on opiates. Long answer is we're having to use it more because of the increased effects of the fentanyl that we're seeing on the street.
We're also seeing drugs that are mixed with fentanyl or other things, synthetics. We're a lot harder to manage the patients. You give the naloxone, the Narcan, and generally they wake up 1, maybe 2 doses. Sometimes we're breathing for them. Sometimes they're in full cardiac arrest. Most of the time they'll come back. But when you have someone that's using heroin laced with fentanyl, we're seeing, we're taking that part of it away. It's blocking the opiate, but now patients are going into seizure activity. They're getting like an instant withdrawal. Now we're dealing with another drug now that's presented. We have a lot of people difficult managing their airways. Also, no oxygen airway. Now you're doing brain damage, as Dr. Mendoza was showing some of the slides up there. So when there's a mixture, it's a lot serious. The outcome's never usually that positive, and it takes a long time to recover with definitely some lasting effects. And it's a a lot more difficult for us to manage that patient and be able to get them successfully to the hospital, upright, talking, breathing. So.
And just so everyone's aware, we do have Narcan at the school. This question's for Mr. Zerbe. What are the most lethal drugs or drug combinations that you're seeing right now?
It's definitely in the opioid world, but there's, you all heard of heroin. Heroin's an opiate, and it's kind of like, let's give that like a 1 as a value for how strong it is. Then there's fentanyl, and then fentanyl's out there being, let's say 100 times that. So you need 1/100th of the amount of fentanyl to equal the same unit of heroin. Then you get into like carfentanil, which was actually a anesthetic, think about this, designed for elephants. Elephants are really big, and a very little amount of carfentanil was all that was needed to take down an elephant. So that's in the 1,000-time strength range. There's something called furofentanil, which I don't know why it's out there because it doesn't really do anything for anybody, but it's in again, the tens of thousands of range. And even with the marijuana question, while it's not really mixed together at this point, it is with, we're seeing it with crack cocaine and in some cases cocaine. You have no idea what you're buying. I mean, when you go to the pharmacy, the doctor wrote your prescription and they know that you're this old, they know that you have this kind of health, they know that you weigh this much pounds, so you need this much medicine, and the pharmacist is going to give you a controlled amount of some substance, and it's going to be regulated very precisely. The dirtbag on the street that's just selling you drugs, he don't care. He wants to make the money, so he scoops in whatever he has. There's no quality control to it, none of that. So you have no idea what it is you're taking. Many of the people, the experienced heroin addicts, can maintain themselves on heroin relatively decently, but they buy a drug because a regular guy's gone and they pick up some other guy in the corner, and now they take that same unit because they think that's what it is, and it turns out it's a furofentanil or fentanyl or carfentanil, and that's it. There's nothing that looks at this. You can't look at it. It's not in the bottle. It's not anything. Knowing what you have is so huge. Downstate, there was an issue with someone who got a pill press and was making fentanyl into pills that there was some other medication. It isn't normally prescribed, kind of a harmless medication, but it was actually fentanyl. So you could sneak it someplace. And someone looked at it and said, oh, that's just aspirin. So the mixtures out there, anyone in the fentanyl family is just profoundly dangerous, and you don't know what it is, and that's what sadly takes most of the people that we see in our office. No one, not say no one, but very few people die of a medication overdose. It's some combination of a whole bunch of stuff.
Ms. Drescher, what are good conversation starters for parents to use when starting to talk to their kids about drugs and alcohol?
I believe in open-ended questions. To the best of your ability, try to stay away from anything that's a closed-ended question that could be answered as a yes or a no or a So just asking questions that show you're genuinely interested in how they're doing, and what's interesting to them, what's new in their life, what challenges are they experiencing. What we tend to do as parents, because we're so driven by the fear of knowing that our kids may be using drugs, is we tend to give a lot of well-intended advice. And we try to find every opportunity that we can to try to drill this good advice into our kids. Well, the fact is, at that point, it's probably too late. So again, back to what I said earlier, the best thing you can do is try to engage them, let them know and feel that you are on their side, which means anything that contributes to their sense of self-loathing is something I would try to avoid. Because when these kids cross that line into addiction and their behaviors change and they behave like monsters, they begin doing things that aren't like them at all, they already hate themselves. And to let them know that you're there to support them through any change that they would be willing to make is the most important message that they can hear.
The next question was for me. If a student tells a school faculty member or a counselor that they are using drugs, will parents be informed? So when I first bring a student down to my office, the first things I always say is that you're not going to get in any kind of trouble for anything that's said in my office. That everything that is said between myself and that student will stay between me and that student and under certain circumstances. What I work very hard with is to build a very trusting, open relationship with the students that I work with. And if a student does confide in me that they are using, what I do is I work to help that student find a way to tell their parents themselves that they're using. So I will work with that student to figure out, okay, what is our plan to get you some help? In order to get you some help, we need to involve the people that love you. The people that love you will go to the ends of the earth to help you to solve this problem. And again, we already know that addiction can't be conquered on your own. You need help from everybody around you. So I will work with that student to build up enough trust that maybe we can call their parents together and tell them what's going on, or we can send them home with some good ways, some good talking points that they can work with a parent. Obviously, if your child is in imminent danger, by all means, you will be contacted by the school. But I really work to make it, a workable relationship that the kid will come and tell you themselves what's going on, and that I can just be there to support the family. Chief Mears, what is a parent's liability if children are found using drugs or alcohol on their property? And then there's kind of a qualifier to this. Their liability if they have supplied the drugs or alcohol to the children, and then their liability if they have not supplied the drugs or alcohol, but their kids are still found using on their property.
Well, if we've got kids that are using alcohol or drugs on the property that's supplied by parents, that parent can be arrested one time for each child that's using on their property. So if you've got a party of 25 kids and they're all drinking, that could be 25 charges for endangering the welfare of a child. So the liability is huge, and that's criminal liability. That's what I'm talking about. As for if the kids get it on their own, they bring it on your property. Now the criminal liability, if the parent doesn't really know anything, probably not any criminal liability there. But if one of those kids is drinking on your property and they have too much to drink and they fall down on your driveway and crack their head open, you own that pretty much through your insurance company or out of your pocket. So be aware of what's going on in your property. And I know how hard it is. I've got 2 teenage kids myself. You don't always know every minute of every day what's going on in your house, but you have to. I mean, you really have to have a good idea. I hope that answers your question. And if you ever think there's something going on, if you think there's a party that is going on at your house and there's some underage kids that are drinking, we don't have to show up and arrest everybody. We don't have to show up and arrest you. We want to make sure that everybody gets home safe. Now, I'm not saying that if we show up, you're not going to get arrested. If somebody else calls us there, that could happen. That's an option. But if you call us because you got an out-of-control party or some kids are drinking on your property and in good faith you're trying to take care of that, we will work with you. So, that's the big thing, is getting everybody home safely and addressing the issue. If that didn't answer your question and any more details, feel free to give me a shout at the police department.
Can I just add to that, just based on some of the parents that I see, there is a disturbing trend of parents who are either looking the other way or endorsing that their kids are having marijuana parties at their house. And I think the feeling is, and again, it's fear-driven, the feeling is, well, if I let them do it here and I take their keys, then I know they're safe. But knowing they're safe and endorsing the use of marijuana are 2 very different objectives. So there's a lot of research that supports that looking the other way, I mean, forget about condoning it, okay? But even just looking the other way and not being really clear with your kids about your position on their drug use, on any kind of drug use, suggests to the kids that it's okay. And the research shows that kids that know how their parents firmly feel about it are less likely, not impossible. I knew clearly how my parents felt about it when I was in high school, and it didn't stop me. However, the research shows how important it is that parents be really clear and firm about their position on use.
So this question is for Mr. DeSalvo. What does an OD look like, and how do you know if someone's overdosed?
You know someone overdoses because they're not acting right. They're either unconscious, they're not breathing, or they're erratic depending on what the drug is they're overdosed on, or it could be something similar as alcohol. Alcohol is a drug. They could just be passed out, snoring, drunk. It all depends. And so there's a lot of different various ways of how it looks. We've seen people in the schools, we've seen people out on the road walking who are erratic. They might be under the influence of something. You don't know always what the drug is. They're not always forthcoming. Drugs come in many different ways: pills, powder, liquid, weed, you name it. So there's a lot out there. There's a lot of different variety out there. And usually we find out about the new stuff after a while. I've seen it, or talking with law enforcement, or at the hospital and talking with the physicians when we see something new come in, and then we all have to learn about that and how to deal with it. Make sure if we come in contact with it, it's not dangerous for the first responders either. So a lot of different variety out there.
A lot of times when we respond to the overdoses, if you find somebody that you believe is overdosed, you might see needles laying around. You might see the small waxy looking envelopes. You might just see some white powder laying nearby. But the overdoses, a lot of the overdoses we're going to now, the people still have actual needles still in their arm because they think they're buying heroin and they actually get fentanyl. So you see the white powder, you see that a lot, and people can either inject it or some people snort it, so you might see white powder around their nose or around their face. So that might be one of the other signs that you see at the scene of an overdose.
So I'm going to qualify this as this is a difficult question. It's a good question, but it's a difficult answer. I think I'm going to pose this to Ms. Drescher. Are the rates of successful recovery or recidivism the same for opioid addiction as for other drugs? And what are the rates of successful recovery?
The million-dollar question that everybody wants to know. And I'm honestly, maybe Dr. Mendoza knows, I'm always very suspect, I guess, of data. You know, the rehab centers will tell you one thing, and there's an awful lot of data out there. But I will tell you this. There are 23 million people out there in this country walking in recovery, many of them from opiate addiction. So recovery is possible. And family members need to understand the important role that they play. Oftentimes we get the message that says, you know, we didn't cause it, we didn't cure it, we can't control it, and those things are true. But we can learn to be effective in helping to manage it. And it starts with those conversations, the open-ended questions, and suspending all judgment. It doesn't mean that there aren't consequences, and it doesn't mean that you don't need to be clear about what your plan is and what your boundaries are. But there are ways to help your loved one find their motivation to change. And it ultimately comes down to that. And we're seeing a lot of the treatment protocols are changing around evidence-based practices that emphasize motivation. We can force people into treatment, and that may work short-term, but long-term sustainable recovery comes from motivation. And so many of the practices today are really focused on helping somebody to find that motivation for change.
I don't know the numbers off the top of my head, but and I would say that a lot of the data that are reported are limited. We don't know how to collect all the data, even within this county. You know, we can get death data, we can get all sorts of numbers, but you know, at the end of the day, a lot of the data that we see are incomplete. You know, and I think with this problem, as I mentioned earlier, I think frankly the stories are more powerful than the numbers. And you know, I have a number of patients in my practice who I take care of, and they thankfully have survived. They're in recovery. As I mentioned earlier, you know, addiction is a chronic illness. It's not unlike hypertension or cancer in that, you know, if you get over the initial hump, you still have a life for the rest of your days of trying to manage that being in remission. And you know, it takes a lot of work. It's not as simple as taking medications. I mean, taking medications would be, if that was all it was, it'd be easy. But people who are struggling through recovery need all sorts of support, multimodal support through medications is definitely a part of it, but counseling, support, peer advocacy, I mean, a whole host of services that we are able to deploy for people in this situation. But the number one thing is getting them through the hump, and what we don't want to see is losing them to overdose.
I have a question for Deputy Rush. How can a parent protect their child from abusing drugs and alcohol who will be going off to college next year?
Well, that's a really good question, and I'm not sure I have the answer, because college is a place where kids tend to experiment with alcohol and in some cases other drugs. And I attend the Finger Lakes Collegiate Task Force, if anybody's heard of it. It's a group of the Finger Lakes region of colleges and universities, drug counselors that meet once a month, and they discuss the issues that they're having on their campuses with drugs. And one of the main problems they're having, going back to marijuana, in fact, they're going to do a conference just on marijuana this year. One of the telltale signs of a student on marijuana or addicted to marijuana is they're on academic suspension, because their grades go down because they can't concentrate on their studies. And I'm not sure what the option is, or what a parent can do, I guess, to try to stop that, because there are a lot of experimentation with, and alcohol is very, very high on the list, and not only from all the area colleges that we visit from time to time regarding primarily alcohol and marijuana issues and problems. I'm sorry I can't answer that better than that. Maybe somebody else on the panel can assist with that.
I would say just lay the groundwork early as you can. I think that just about every school district in this area has a DARE program. Our DARE officer is here today. She gave up her night off to come out here. She's out there somewhere. Officer Rath, and I know Deputy Rush has done DARE program for, well, many years. And you got to lay the foundation early. You got to have the discussion early. Not because you didn't have it when they were in 5th grade, does that mean you can't have it now? No. And it doesn't mean it's going to have any less impact, because quite frankly, I think the kids and their teens want to hear it. I think they want to hear that their parents care, and that they don't want to see them fail at college. We all want our kids to succeed when they go off to college. And one easy way to derail that is through, starting to use marijuana or starting to use something heavier. So lay the foundation early, have the honest discussion. It's a tough one. I know, I've given it twice now. It's an ongoing process. It's not just a, hey, don't do drugs. It's, how are things going? How are your classes going? What are your friends doing? Who was at the party the other night? And does it sound like the 5th degree? Yeah, probably, but I think a lot of kids want to hear that. They want to know that you care, and they want to know that you want to know what they're doing. And I think once you give that up, that's when the slope starts. So just keep having those discussions, keep it up.
Has Spencerport or Ogden discussed opening a drop-in center to get people directly connected to treatment, like the North Clinton Ave neighborhood?
We will pick up anybody and take them to the clinic. I believe it's on University Avenue. I apologize, I don't have the address in front of me. But there is a drop-in clinic, and it's just recently expanded their hours into evening hours. My officers will take anybody there 24 hours a day, 7 days a week, anytime they're open. If they want help, we will take them there. And I know Gates EMS will probably do the same thing. And I know the Sheriff's Department will do the same thing. So we want folks to get into recovery as fast as they can, earlier the better, and we'll get you there. If you or somebody that you know wants to go there and you can't get them there, we have a car, we'll take them.
I do know there is a drop-in, there's a drop-in evening at the, actually, is anybody here from the Gates? I can't see.
You just stepped up.
At the Gates Town Hall on Thursday nights from 5 to 8. There's also a drop-in center for people looking for treatment, families looking for support, and resources.
Thank you.
They expanded Tuesday, but right now it's Thursdays 5 to 8. Right at the Gates Town Hall.
There's nothing specific to Ogden or Spencerport, but we come into contact with people all the time who want to get into a program, and we take them. And a lot of the people that we come into contact with, it's either at an overdose or just after recovery, after they've had their Narcan and they're starting to realize how close they were to dying. A lot of times they'll just say, can you just get me to a program tonight? I need to go tonight because I'm going to use again if I don't go tonight. And we'll take them. We'll take them to the hospital. We'll take them where they want to go.
How does someone get involved with the prevention end, and are there any parent support groups?
Was the first one, how does someone get involved with prevention?
Yes.
Well, most communities have prevention councils, so I would suggest contacting them. I know the one in Rochester is the National Council on Alcohol and Drug Dependency, ncadd-ra.org, but most communities also have their own councils, and I would also encourage you to speak to your school districts to do more things like this. Also to use, again, evidence-based practices around prevention. And there are programs besides DARE that are showing a lot of effectiveness. Even, young kids who have struggled with addiction coming in and speaking at an assembly to the high school and even to the junior high schools about that very real story. Can be extremely effective, and then creating ways to connect with those kids afterwards. What was the second part of the question?
Are there any support groups for parents?
There are support groups. Recovery Fitness has I hate to say it, it's a mom's group on Wednesday night, because one of the things we find, and it's sad, but one of the things that we find is most of the times it is the moms who are speaking out, who are getting involved, who are asking for help. And I don't think it's not an indictment against dads. I think the dads just tend to be a little bit quieter about this. Ideally, you get support as a couple, because being on the same page as parents is so vitally important to your child's success. So there is a Wednesday night, once a month group at Recovery Fitness. You can go on their website and find out about it. There are also the mutual aid groups, Al-Anon, Nar-Anon, and periodically, my website is recoverycoachuniversity.com. Periodically, we run parent-coach support groups as well.
What preventative steps is Spencerport School District doing to combat substance abuse and addiction? Well, I think the best thing they did was hire me this year. But actually, Lori had mentioned one thing that we're actually doing beginning next week. In our high school, we're actually having young men who are in substance abuse recovery are coming, and speaking to all of our PE classes and sharing their life stories of recovery with all of our students. Anybody who's a parent in the district got a letter home regarding this. Those talks are going to take place in PE classes on October 16th, 17th, 30th, and 31st. If anyone wants more information on any of those, please contact me. The same agency just gave a presentation to our faculty meeting 2 weeks ago, and the young men who spoke were just so inspiring, and it was just so wonderful to hear their stories. But like Lori said, it's so much more powerful for teens to hear it from other teens. It's much more believable than hearing it from us. We are working on looking at all of the prevention programs in all of our K through 5 schools right now. We have other efforts that we're doing in the middle school and the high school as well. We're gearing up for Red Ribbon Week, which is the 22nd through the 25th of October. Our care team just spent an entire morning working on all the efforts for that. So hopefully your kids are going to come home and talk about all the things that they're learning around school, and hopefully the take-home messages will be really real for them. In addition to that, I am here district-wide. If anyone has any concerns, if they want me to meet with their child, if you want to meet as a family, please reach out to me and contact me. So these are some of the resources that we have right here in Spencerport right now. So the care team is, as Mr. McCabe had said in the beginning of our presentation, it's made up of teachers, counselors, and support staff. And you can make any confidential referrals that you have if you think that there might be a student using. So this may not even just be for your children, but if you think a child's friend is using, teachers can use this as well. Referrals can come to me. There can be a name attached. It can be completely anonymous, but they will come to me, and I will kind of try to triage what needs the family or the student might need at that point. If you're interested in making a care team referral, just go to our website, which is on the Spencerport High School's main page under care team, and there's a referral link right there. Again, you can also contact me directly at my office. My phone number is also on that care team website. And then we also are an extremely fortunate district to have the Family Support Center. It is a no-fee short-term counseling that is open to all students and their family members in the district. The manager of our Family Support Center is here with us this evening, Erin Hassel, who is fantastic. And if you have any questions, feel free to reach out to Erin as well. She has a website as well, linked to the Spencerport High School website with, actually I think it's just the Spencerport Central School website with a wealth of wonderful information. I would just like to, before Mr. McCabe comes up and gives a formal closure, I would just like to thank all of our panel members. I have so been looking forward to tonight for the last few months, and I think you guys just did a wonderful job tonight. Thank you for all of the information. I really appreciate it.
And again, I would like to thank our panelists for being here tonight and all of you for spending the evening with us with this really important information. I think the biggest thing I've learned in my 13 years here in the district as an assistant principal and a principal is just like all our panelists have said, and the message that we're trying to give is this is something that we need to recognize as an issue. It's nothing to be ashamed of. I think what you would be ashamed of if you didn't recognize it and you didn't try to address the problem. So again, I really appreciate everybody being here, and I especially want to thank Kate and Lindsay again for helping to facilitate this. So a round of applause for them for all their efforts. So thank you again for being here, and I hope everybody has a great evening.